If you want awesome products at great prices, check out the description. New research reveals a critical oversight in cervical cancer prevention. Women over 65 remain at significantly elevated risk, prompting calls for extended screening programs. While cervical cancer is largely preventable, the World Health Organization reported approximately 660,000 cases and 350,000 deaths globally in 2022 alone, a stark reminder of this disease's devastating impact. The culprit? Human papillomavirus, HPV, responsible for roughly 95% of cervical cancers, where abnormal cells in the cervix develop and potentially become cancerous tumors. The alarming statistic of 1 in 3 UK women being overdue for screening underscores a critical gap in preventative care. The WHO's ambitious global strategy aims to vaccinate 90% of girls against HPV by age 15, screen 70% of women, and treat 90% of those with cervical disease by 2030, a target projected to prevent 62 million deaths and 74 million new cases by 2120. Current screening guidelines in many countries, however, often cease after age 65, assuming previous tests were normal. This practice, however, clashes with rising global cervical cancer cases among older women. 157,182 new cases and 124,269 deaths in 2022 among women aged 65 and older. While the UK boasts higher screening and vaccination rates than many nations, recent years have witnessed a concerning decline. England alone experiences approximately 685 cervical cancer deaths annually, highlighting a persistent challenge. A groundbreaking observational study, published in Gynecology and Obstetrics Clinical Medicine, analyzed data from over 2 million women in China between 2017 and 2023. This extensive research revealed a significantly higher prevalence of high-risk HPV infections and abnormal cells among women aged 65 and over compared to younger counterparts. Nearly 14% of women aged 65 and above tested positive for high-risk HPV, dwarfing the 8% rate among younger women. Furthermore, older women demonstrated a greater likelihood of multiple HPV infections and abnormal cellular findings during screening. The study authors, while acknowledging limitations, strongly advocate for urgent global action, recognizing older women as a high-risk group demanding immediate attention. Current guidelines, they contend, may be insufficient for women over 65, who may lack vaccination or comprehensive screening. Increasing life expectancy further magnifies this demographic's heightened vulnerability. Athena Lamnisos, chief executive of the Eve Appeal Cancer Charity, emphasizes the largely unvaccinated population among women over 65, underscoring their significant risk if underscreened or lacking any prior screening. The charity urges the National Screening Committee to review the current screening age. Maxine Lenza of Cancer Research UK points out that improved testing in the UK significantly reduces cervical cancer risk for those up to date with screening. However, she clarifies that women over 65 who have never been screened should consult their GP to request a test. An NHS spokesperson confirms that the current cervical screening program in England follows expert recommendations from the UK National Screening Committee, based on the latest global evidence. Women with positive HPV results at age 65 receive further screening to monitor ongoing risk. The NHS spokesperson encourages all women to attend their scheduled appointments for optimal protection. A Department of Health and Social Care spokesperson reiterated that screening age brackets are based on strong scientific evidence and expert recommendations. However, they emphasize that any woman concerned about symptoms should consult their GP. Simultaneously, the department emphasizes the importance of increasing screening uptake within the existing age bracket. Their 10-year health plan aims to improve access through convenient HPV self-sampling kits, focusing on a preventative approach rather than solely reactive treatment. This compelling evidence necessitates a crucial reassessment of cervical cancer screening strategies, emphasizing the urgent need to protect older women from this preventable disease. The ongoing discussion underscores the need for proactive measures, bridging the gap in current guidelines and ensuring equitable access to life-saving screening for all women, regardless of age. The data is clear: extending screening to older women could save lives, and the time for action is now. This is a story that demands attention, a call to action that resonates far beyond headlines and research papers. The lives of thousands depend on a timely response.